Hello, welcome once again to Moorgate Andrology, and today I want to talk about tips after having penis enlargement surgery. Now, if you've had a penis enlargement surgery done, then it's very important that you follow the right post-operative advice by your urologist. The first thing you'll notice when you leave the hospital is that you're going to be discharged with some antibiotics and some pain relief medication. And it's very important that you take this according to your doctor's instructions. You must take the antibiotics even if you feel well afterwards. Penis enlargement is not particularly a painful procedure for most. One of our urologists describes it as not as bad as a tooth job, but you will feel a little bit sore and you will have some bruising and some swelling after the surgery. So it's important to take it easy for a few days. If you do a sedentary job, then 2 to 3 days off work is usually enough. But if you have a particularly physical job, then you may need to take a little bit longer off work. Now, the first thing I want to mention is it's very important not to engage in any sexual activity for 6 weeks. You need time for the fat transfer aspect of the surgery to settle down. If you have sex too soon, then it's quite possible to move the fat towards the base of the penis and make things look a little bit uneven. So we don't want that. So no sex for 6 weeks. And similarly, try and avoid strenuous physical exercise, gym activity for about 4 weeks. Just let things settle down at first. Now, lots of guys worry about erections after the surgery. They say, is it okay to have an erection after having quite soon after having the penis enlargement surgery? Well, the answer is yes. In actual fact, they're beneficial because the erections help to distribute the fat evenly up and down the shaft of the penis in the first weeks after the surgery. So don't worry about erections afterwards. That's absolutely fine. Now, the other key takeaway message is massage. So your urologist will show you how to massage the penis each day after the surgery. The reason for this is that when you've had a really big fat transfer, you'll find that some of the fat, about 30% of the fat that's put into the penis, will disappear, will absorb. This is perfectly normal, and it's very important to massage about 5 to 6 times each day for about 1 to 2 minutes. This will help keep that even distribution of the fat along the penile shaft after the surgery. So that's a very important part of the post-operative regime is massage, about 5 to 6 times a day for about 1 to 2 minutes. Now, you may find that if you are not circumcised, you might find that the foreskin of the penis becomes a little bit tight quite soon after the surgery, and this may last for a few weeks. This is common. This is very common in a big fat transfer because the fat tends to gravitate a little bit towards the tip, and the foreskin is very soft, so the fat tends to find its way there. But again, massage from the tip to the base, pulling the fat back, usually helps to resolve that over the course of time. So if you find the foreskin getting a little bit tight, don't worry. Just continue with the massage, in that case from the tip to the base, and that should help resolve that over the following weeks. Now, the other thing to think about is showering and bathing. Try to avoid baths for about the first week or so. Take showers at first. It might be 2 to 3 days before you can take a shower, but then take showers at first rather than baths until the wounds are healed and everything is looking good. Most urologists will use dissolvable sutures in the incision where we access the suspensory ligament for increasing the length, if of course you're having the lengthening surgery done. Those stitches will fall out on their own. If you've just had the girth increased, then you're not going to have that problem. You may also have 1 or 2 little puncture wounds at the lower belly where the fat was taken from for the fat transfer, and there may be just one little suture in there, which again will fall out on its own. And I think that's about it. Those are the key takeaway messages after having penis enlargement surgery. It's important to remember that whatever your urologist has told you to do, very important to follow the post-operative advice very, very carefully and to the letter, because it's not just about the surgery. There's quite a bit of work to do afterwards. One last thing to remember, of course, is the extender. If you've had the lengthening surgery, then you should be given a post-op traction device that you wear on the penis, usually from about 6 weeks. When things have settled down, the urologist generally gives you a traction device to wear on the penis for the following 9 to 12 months to help increase erect length. Well, that's all from me today. I hope that's given you some insight into what to do and how things work after you've had penis enlargement surgery. If you'd like to know more about the surgery itself, then please do get in touch with us here at Moorgate Andrology. We do offer a free WhatsApp video consultation with the urologist himself, so you can find out more and talk to the doctor directly, and that's completely free. You can also find a lot more information at our website, www.moorgateandrology.co.uk. And also on YouTube here, there are plenty more videos about penis enlargement generally, which I hope you'll find interesting. Thanks for watching. I'll see you back here next time at Moorgate Andrology. Until then, bye for now.